Hey there YouTube, this is Harmony from Transform and welcome to my channel. So a lot of things that people ask are, what do you wish that you knew before nursing school? And to be honest, there's a lot of things that I wish I knew before nursing school. But one of the biggest things would be I wish someone told me how much time nursing school would take and the amount of sacrifice that you would have to put into it. To give you a personal example, I started nursing school and it was extremely difficult. I became almost like a social shut-in, like my friends didn't see me, and it wasn't that I was trying to ignore them, but I was just so overwhelmed with studying that it was just, they came second and passing came first. So I get an invitation to what I considered my best friend's wedding. And, the alarm bells are kind of going off because I'm thinking, oh my gosh, I thought for sure I was going to be a bridesmaid in this. But then I looked back and I hadn't talked to her in 5 months. No texts, no calls, no anything. And I was like, well, at least I got an invitation to the wedding. So it's just kind of really ridiculous. You don't realize the amount of time and the amount of sacrifice that you have to put into nursing school. Luckily for me, my friend, I talked to her and we actually are still friends now, and I'm out of school for 4 years. And it was just, a rough patch. But the sacrifice and the time commitment is huge in nursing school. Another thing that I wish somebody had talked to me about is NCLEX questions. So before nursing school, I was a straight A student. I think the worst grade I'd gotten was an A- in micro, and that killed me. So I get my first NCLEX test back, and we need 78s to pass, and I'm like, I got this. I'm an A student. I did not have it. I got a 72 on my first nursing test, and I was crushed, and I just didn't understand why. And we're going over the questions, and I still remember this one question, and it goes, you have a patient with a hearing aid. And what do you do? And one's talk loudly and clearly, smack gum loudly, turn the television off, and then some other bogus throwaway answer. And I was like, this is easy. Talk loudly and clearly. Wait, what? What do you mean it's turn the television off? Well, hearing aids amplify the sound in the entire room, so you're supposed to turn the hearing aid off. Turn the television off. And I'm looking at her you mean I'm supposed to go into the cranky old man who's already cranky and ratchety, and I'm supposed to be sorry, sir, let me turn your television off so I can give you your, Lovenox shot. It didn't really jive with me, but that was how nursing, NCLEX questions were. They sometimes went against my logic, and it was no, this is what we do. Or the other questions would be you have a patient, going through this horrible situation, and they've got, breathing problems, heart problems, all this stuff. And it's what do you do first? And I'm well, darn, dude looks like he's gonna die anyway. He's got all this stuff wrong with him. What's gonna kill him first? And then I'd be airway, breathing, circulation. So let's go to airway. All right, so let's do that. And usually that was the right way to go about it. So NCLEX questions, ABCs, your best friend. Airway, breathing, circulation. If you go by that, it's 90% of the time you're going to get your questions right. So yeah, long story short though, there's a lot of things that I wish I knew before nursing school. But those are definitely two of the big ones. Other than that, I would say when I was in clinical, I wish somebody had kind of given me a heads up saying, this is not how real nursing is going to be. You're in clinical and you get there early and you look up your patient, you have all the time in the world, and then you learn about their disease process, and then you get your one patient or maybe two if you're a senior. And, after that, you take care of the two patients, and then you're oh wow, that was hard. And you're there for your 8-hour clinical rotation. And you don't realize that real nursing, you get 6 patients on a med surg floor. At least in Pennsylvania you do. They'll tell you in your interview, you're going to have 4 patients at most. Lies. Straight up lies. You're going to have 6 patients. I mean, it might not be right when you get off orientation, but like I was, I think, a day, maybe 2 days off of orientation, and they're like, you've got this, Harmony. Here's 6 patients. And like this one over here has a wound vac. And this one over here, I was like on a med surg unit. So like everyone had wounds, everyone had everything. And it was so overwhelming because here I am, I'm like 3 months out of nursing school. I'm like used to having my 2 patients. They like worked me up to like 4 during my 3-month orientation. And then I'm like, got this. So, I mean, there's just a lot of things that I wish I knew before nursing school, but those are just some of them. If you have any, things you'd like to add, things that you maybe wish you knew before nursing school, definitely comment them in below. And, thanks for watching. Bye.